So on Monday, schools will be open with reinforced safety measures in place, including the provision of 3-layer disposable masks, which are the masks that look like these ones. And those are the masks that we have been providing in schools throughout the pandemic, and we've worked to ensure that districts have a good supply of those masks. There will be measures to reduce crowding, to stagger break times. We will be shifting to virtual assemblies, virtual staff meetings. We will be restricting visitors to schools for the time being. And I would like to say about masks that we know that we've been advised by public health, of course, that masks are an important layer of protection, and that students and staff will continue to use this important layer of protection while they're in schools. And so what Monday will look like when students come back to class is a refresher on the proper way to use a mask, the importance of using a mask, how it can help keep everybody safe, as well as a refresher on the overall safety plan. I mean, we do ask parents to send their child to school with a 3-layer mask. However, we will ensure that these masks are available at school for anyone who needs one. And it is critical that every single day before coming to school, students complete a daily health check, staff as well, to stay home if they have any symptoms. When it comes to communicating with the school community what's happening in our schools with COVID, I understand that parents and caregivers want to know what's happening with COVID in schools. And so we have worked with public health on a system to ensure that we can continue to provide communication to parents. This is going to look, though, very different from what has been in place before, because as public health has advised us, individual case management and contact tracing is no longer a helpful tool for us in tracking cases in schools. We need a proxy to understand what may be happening with COVID in schools. And so that proxy will be school attendance. Schools will be monitoring attendance rates closely and will notify public health and the school community if attendance dips notably below typical rates for this time of year. And that will trigger a response from public health, which may include investigation. It might include the use of rapid tests to get a better understanding of what's happening on the ground. Now, I do want to assure everyone that, of course, our school medical health officers work very closely with school district leadership on a regular basis, a day-to-day basis, and that, of course, will continue. To help with effective information sharing, parents are encouraged to report rapid test results to public health and to ensure they contact the school if their child is staying home because of illness. By working together, we will be able to best understand what's happening in our school communities and to determine how and what to communicate with parents.